My name's Antonia. I'm an assistant psychologist and I work for the Isle of Man Government's Community Wellbeing Service. This is a video for frontline workers relating to depression. Depression is a common mental health condition that can affect the way we think and feel and the things that we do. The effects and experience of depression can range from mild to severe. While most people feel sad or disheartened from time to time, depression may have a more significant impact on your life. Symptoms of depression may include feelings such as despair, sadness, hopelessness, and sometimes anxiety and anger. Your behaviour may change, such as using substances like alcohol to try to cope, avoiding your friends and family, and neglecting yourself and your home environment. The current circumstances in which we find ourselves may be different to those in which we are usually working. The increased pressure and uncertainty surrounding COVID-19 may have led to changes in the way you feel and think about yourself, other people, the world, and the future. It might be that you have found that you don't want to talk to your friends and family about what you are having to deal with, and are struggling to cope with emotions that you wouldn't experience as regularly as now, such as guilt and fear, and perhaps an increased sense of responsibility. People with symptoms of depression and people who may be facing increased stress or vulnerability may be experiencing an increase in unhelpful habits of thought. Unhelpful thinking is directly linked to unpleasant negative emotions and can serve to maintain depression. You may have noticed a change in your own thinking. People experiencing depression tend to have continuous, automatic negative thoughts and unwittingly make routine thinking errors such as all or nothing thinking, overgeneralizing, catastrophizing, and have attentional bias towards the negative. Stress may be just one of the risk factors that makes you more vulnerable to experiencing depression. Other vulnerability factors may include underlying health conditions or other mental health conditions, substance misuse, mental ill health in blood relatives, bereavement and grief, and historical factors such as stresses and disruptions in childhood and adolescence. A combination of vulnerability factors, current levels of stress, and maintenance factors such as negative self-talk or unhelpful behaviours may lead to depression. It may be both easier and more difficult to spot them in your patients or colleagues. However, doing so may be the first step in helping them access support. While you already have a lot going on, it may be helpful to try to notice in the process of your work some of the symptoms we've already considered. Other signs to spot may be in the things people say, such as "there's no point trying, I'm completely worthless," and "I don't deserve to be here, I can't do anything right." Try to notice people who may feel more lonely, despairing or hopeless, or who may be withdrawing into themselves, avoiding taking care of themselves or doing things they enjoy, and even struggling with concentration and memory. It can be really difficult to know what the right thing to do is to support a patient or colleague who you think may be experiencing symptoms of depression. The best thing to do is likely to talk to them. It's not your job to try to fix their problem, but listening and offering support where you can, even so-called simple emotional support, may be invaluable to them. The acronym ALERT may offer a little direction. Firstly, approach the person. Then listen, non-judgmentally, to what they say. Try to focus on what it is that they are actually saying and not put your own judgment or assessment on it. Explain clearly the information you have. Reinforce that there is help available. Remember, that doesn't have to be taking that responsibility on yourself. Take time for yourself. Reflect, check in, and look after yourself. This is just as important as assisting someone else. Approach, listen, explain, reinforce, and take time for you. ALERT. Though everyone's experience of depression is unique, there may be some simple techniques we can use to help ourselves cope and thrive in these difficult times. Number 1, prioritise your sleep. While it's a popular misconception that we need 8 hours of sleep to function, it's certainly true that we do consistently need good levels of sleep to stay physically and mentally well. Give yourself enough time and opportunity to sleep and practice good sleep hygiene. Note that you may even need a little more sleep than usual if your brain is trying to process and make sense of difficult things you have experienced. Number 2, similarly, prioritise adequate nutrition. This is likely advice that you have heard over and over again and may even have given yourself. but take some time to reflect on whether you are giving yourself the best set of circumstances to stay well. Protein, fruits and vegetables, and slow-release whole grain carbohydrates are proven to be more conducive to positive well-being than relying on sugar and caffeine for nutrition. Number 3, reflect on the thoughts you're having and your self-talk. It may be helpful to open up about them to someone you trust and explore whether they are helpful and rational, or perhaps unhelpful and contributing to low mood. It's not unusual for this to happen at times of stress, and acknowledging and challenging our automatic assumptions can be really effective. Number 4, engage in some simple, pleasant activities when you're not at work. What you enjoy will be unique to you, but it is likely that spending time doing things that you get a sense of pleasure and achievement from will make you feel more positive. Though it's tempting when you feel depressed to hide away and avoid the things you enjoy, even doing a little may make you feel better than not doing at all. Number 5, stay connected. As far as possible and appropriate, stay in touch with your support network. This might be spiritual or community groups, family and friends, or people associated with your hobbies and interests. With the extensive availability of social media, it is easier than ever to stay in touch. Try speaking with people on the phone or via video, as well as through messages, and watching what people upload online. Hearing someone's voice may give you a better insight into their life and help you feel more connected to them, and they to you. You may find it helpful to research your own advice in staying well and coping with symptoms of depression. It may be helpful for you to familiarise yourself with some of the signposting options that are available for yourself, colleagues and patients. First and foremost, consider the staff welfare service that is open to anyone who works within or for the government. At the moment, they're providing a telephone emotional support line specifically for frontline workers who may be affected by the current circumstances. You can contact them on 687 005 from 8 AM to 6 PM 7 days a week. A person's GP tends to be the best first point of contact for a person's physical and mental health. This doesn't necessarily mean that the person reaching out for help will have to start taking medication, but it may be an appropriate option that the GP can advise on. Similarly, they may be the best placed person to consider an onwards referral for more specialist services, just as with physical health issues. At the Community Wellbeing Service, we accept referrals from people who may be experiencing common mental health conditions such as depression. Following assessment, we may provide brief therapeutic interventions for mild, moderate, and moderately severe symptoms of common mental health conditions. You can complete a self-referral online via our government webpage. In many cases, third sector organisations will be best placed to help you or someone you support to get help. There are a number of excellent services on the island, which include Cruise Bereavement Care, Isle of Man, for grief and coping with loss. They can be contacted on 668 191. Motivate Addiction Services for addictive behaviours, including alcohol concerns, on 627 656. And the Samaritans for emotional support on 116 123. In the event of mental health crisis, contact the Crisis Response and Home Treatment Team on 642 860, and in an emergency, always call 999. Some useful websites and online resources include Mind, the mental health charity, Mood Juice at moodjuice.scot.nhs, and getselfhelp.co.uk. Take care, stay safe, and thank you for everything you're doing for us.